All right, chapter 24 is on cognitive disorders, and within this chapter we're going to focus on the differences between delirium and dementia, and then we'll also talk about Alzheimer's disease, which is a subtype of dementia. So with delirium, it is a change of cognition that develops over a short period of time, and that short period of time is key there with delirium. And these patients are going to have difficulty paying attention. They will be easily distracted, disoriented, and that also they can have some sensory disturbances such as hallucinations or illusions as well. And delirium is always secondary to another physiological condition. So remember that. So it's a short time period. It develops over a short time period, and there's always a reason, a cause for delirium to develop. And these are some of those causes. Some of them are drug use, and then some of them are infections. Infection is one that we see most often with delirium, especially UTIs in older adults within the ICU, med-surg floor. You have those patients that come in, they're orientated, no problems, but in a few days they become disorientated, possible UTI infection. They often look at that first as their primary cause for it, for their change in level of consciousness or orientation. So some other conditions would be dehydration, hypoglycemia, some electrolyte imbalances, seizures, head traumas, etc. there. So safety is very important with these patients since they're going to be disorientated and they may suffer from the illusions and/or hallucinations as well. So a patient may think that their IV line is a snake and they'll try to pull it out. They'll probably be trying to get out of bed as well. So we want to make sure they're safe. Now if they need to have eyeglasses or if they need to have hearing aids, we need to make sure that these are on in place and working correctly with the batteries and the hearing aid and all that. This is going to help keep them orientated even better whenever they are disorientated. We'll also need to assess for their skin for skin breakdown as well. So if the identifiable cause can be identified and corrected, then complete recovery is possible. However, if it is not identified and not treated, then irreversible damage can occur, such as hypoglycemia. So if we have a patient come in and they are hypoglycemic, they are presenting with symptoms of disorientation, and we don't check their blood sugar, we don't diagnose them as hypoglycemic, that can turn into a coma and death. So see that. But if they come in hypoglycemic and we treat it, then the delirium can be reversible. Some interventions for patients with delirium are to, of course, identify and treat the condition that's causing it, monitor their neurological status, avoid frustrating the patient, which means that you're not going to want to quiz them with orientation questions because we know that they're not going to be able to answer them. And we can't expect them to make decisions as well. So we're just going to have to reorientate them as needed, make sure their sensory aids are on. You're always going to want to approach these patients from the front and slowly so you don't startle them, and then also make sure that the environment is safe. So dementia. Dementia is a progression condition, unlike delirium, which remember, delirium develops over a short period of time. It is a mental disorder that is first seen with memory impairment, and as the disease progresses, the patient's going to decline as well. So we're going to see as the disease progresses, aphasia, apraxia, agnosia, executive functioning, all of those can occur. So this is a good table to distinguish the two that came from your textbook, and then this is the one that came from your ATI book to help you clarify those. So within dementia, there's going to be 3 stages of dementia. Let's see, stage 1. This is when a patient begins to forget things. They have difficulty finding words or losing objects often. Stage 2 is whenever confusion and memory are apparent and they're undeniable. They are still oriented to themselves and place, but during this stage, they may begin to tell stories, or they may say that they need to go pick up their child from school who is now 40 years old and is no longer in school. And so this stage is kind of tricky for nurses because we want to orientate them back to reality for as long as possible, but then there's going to come a time when we reorientate them back to reality, it's going to make them angry and agitated. So at that point, we really have to change our focus, and we have to change the way that we respond to them. So, if we have a patient that says that she needs to go pick up a child from school, and she's the one that starts to get agitated and angry whenever we try to reorientate them, maybe next time we should just say that, well, her husband has called and he said that he was going to pick up the children from school, so she didn't need to worry about that anymore today. So that's how we have to handle that. In stage 3, this final stage, and this is where their personality changes, they often become a completely different person. And I had firsthand on this. We had a patient in a nursing home who was diagnosed with Alzheimer's disease. Her family said growing up she never cussed, very religious, always read her Bible and things like that. And then whenever she got to this last stage of dementia, she would pretty much cuss every sentence that she said. She had no desire to read the Bible. She did not know her family and all that stuff. So whenever the patient declines, we're going to remember about the family as well, because they're going to be going through it with them as well. So here, these are the 3 stages of dementia. So now remember that dementia has a whole spectrum of disorders. So you're going to have Alzheimer's disease, you're going to have Huntington's disease, Parkinson's disease, and all of that. So that's just the overall of dementia. There's 3 stages within that. And then those are the common types of dementia. So Alzheimer's disease. This is the most common form of dementia. It is an irreversible, progressive brain disease that slowly destroys memory and thinking skills. Also loss of speech and motor function, and eventually the ability to carry out the simplest task of daily living. So now here, whenever we start talking about the different stages of Alzheimer's disease, you're going to find lots of different ways that people put these into stages. You can find people that put them into stages of 3 and 4, and then ATI puts them down into 7. For your test, I'm not going to ask you specific stages, but you kind of need to know the progression of Alzheimer's disease, and we're going to go with stages 4, because that's just kind of what I have noticed in other textbooks of what they talk about the most there. So the first stage, the patient is going to experience forgetfulness, and is going to have a hard time learning new things. And at this time, they are becoming aware and they are concerned about these things that they are currently experiencing. In stage 2, confusion is present. This is where they're going to begin to experience a decrease in activities of daily living and decision making, especially within driving. And here at this stage, we often hear of family members taking away the car keys because they're concerned for the patient's safety, and then the others as well. Stage 3 is moderate to severe level, and this is whenever they are not able to identify family members or objects, etc. And they now lose the ability to care for themselves. They often need complete help with dressing, grooming, bathing, and those type of things. Many will start to wander, and if they still live at home, they can often be found outside in the middle of the night walking around, not knowing where they're at. And at that time, the family members usually decide to go ahead and put them in the nursing home whenever that begins to happen. At this stage, their personality is really going to change, and they can become violent. And some studies have said that at this point that they no longer suffer from depression because they are now unaware of the losses that they have. Stage 4 is late or end stage, and this is where they experience agraphia, hyperorality, and they're going to forget how to eat and swallow as well. So a person with Alzheimer's disease, they're often going to die secondary from an infection due to pneumonia, due to the poor nutrition and mobility, or from choking due to the inability to eat and swallow correctly. So a lot of times they don't die directly from the Alzheimer's disease, but a secondary condition to it. Cause of Alzheimer's disease is unknown, but here are some risk factors for developing it. The diagnosis for Alzheimer's disease can only be made after all other possibilities have been ruled out first. So some nursing interventions for taking care of someone with dementia is to be caring and compassionate to them and their families. Now, caregivers should be the same and maintain routine and consistency for patients. And that's why we see Alzheimer's units, we see the same nurses, the same aides back there to keep things consistent. We also need to make sure that we're talking slowly in short, simple sentences and words to the patient while we are looking at them. Patients who are in stage about 1 to 2, they're going to enjoy reminiscing about the happy times. So I really encourage them to do that by asking them questions and just getting to know them. Make sure their sensory aids are on, just like you would with delirium as well. When it comes to dressing and bathing, encourage them to do as much as they can for as long as they can, and also it's a good idea to use Velcro instead of buttons, and that helps the patient remain active as long as possible. Water temperature, make sure you check the water temperature before they get in the bathtub to make sure it's safe. Finger foods that are served in small, bite-sized pieces are the best. They won't be able to use their spoon in the later stages. You know, they're not going to be able to scoop the corn up and then put it into their mouth. It's just not going to be possible. So you want finger foods in small, bite-sized pieces. Bowel and bladder function is also going to decline, so we want to try to keep these patients on a bowel and bladder training schedule for best results. And it's also important to place pictures for the patient to know where things are, such as the bathroom, their closet for their clothes, where their room is, and etc. Also, when they're sleeping, it's going to be important to keep the area well lit, for whenever they wake up, they'll be able to better orientate back to where they're at, and also to decrease the risk for injury. Here are some other interventions. Make sure that you read over those. So there's no cure for dementia. However, there are some medications that have been proven to slow the progression of the disease. Remember, it's not reversible, but they can slow the progression. So Aricept is this drug of choice that helps to slow the deterioration in cognitive function, and the other medication that is most often prescribed is the Dementia, which is used during stages 2 to 4. The ginkgo, that's an herb that you might see people taking, so make sure that whenever we're talking about medications, another good reason to make sure that you're asking about over-the-counter medications and not just prescription medications.